We're good? Well, good morning, and I'm very happy and excited to be here this week. It's my first International Hoof-Care Summit. And a little further introduction of me, I am a practicing human and equine chiropractor, and I'm an avid equestrian. So yesterday people were talking about threes, so that's my three little bit of foundation for what we're going to be having a bit of fun with today. So it seems pretty simple, but I have some goals for us. And generally speaking, I want you to own the difference between conformation and posture, because it's very empowering as a horse person and as a horse care professional, a farrier. And that the foundation of good posture is truly standing for square, which is what I'll define later, and red flags, which are myofascial sites of restriction that hold a history of trauma that are more than just cosmetic. And to understand why and how poor posture and asymmetry can affect the process and the outcome of the farrier's work. It is called horseshoeing. It's not hoof-shoeing. And I may cause a little discourse with some people, but you want to take pride in helping that whole horse and take pride in being part of the team. So yes, we do focus as farriers. You do focus a lot on the foot, but it is helping that whole horse. These are the 4 things I want you to take home. The definition of posture, to distinguish the difference between poor posture and conformation. What truly standing for square is, and the red flags that are more than skin deep. So it seems like a simple bit of information, but in the next 45 minutes, I have about 50 slides to go through. So I'll be moving on pretty quickly. I did try and arrange the slides, so if you download the PDF, that they're pretty self-explanatory. And last minute, I did make some adaptations, so I apologize for some grammar. So we're going to jump in and talk about conformation. Conformation can be more accurately defined by looking at the horse's skeletal structure. A mature horse is going to have the same length of cannon no matter where he is in time and space. So if we look at the bone size, the bone shape, the bone length, and the proportions, the proportion of how large that scapula is compared to how large the pelvis is, that is considered the horse's conformation more accurately. We can see some pictures of the horse's skeleton. So if you think about putting your X-ray vision on, and when you look at the horse, that you're looking through at the skeleton to evaluate the horse's actual skeletal structure, being the horse's conformation. Posture is the big variable. Posture is defined as the symmetry and the arrangement of the skeletal framework. You can look at my posture, and I guarantee you, as I'm standing here today, my posture is going to change, because there's times I'm going to be more confident in my body language, and there's times I'm going to be less confident. As we're less confident, we usually slouch. That's poor posture. So when we're talking about horses, we want to make sure that when we use the terms of mutton withered, camped out, camped under, tight through the throat latch, ewe-necked, that we are talking about poor posture. And hopefully I won't be yelling at you guys too much. I get kind of really adamant about this, and I apologize. But it's very important, and it's very empowering to see a horse that's ewe-necked and not say that that's poor conformation, because we can all improve our posture, and we can help to improve the posture of the horses, which we're going to then affect the outcome and the health and well-being of ourselves by improved posture and our horses. So let's see the difference here. Right? Which pony would you bet on to win the class? Which pony would you buy? Can you guess that it's the same pony? When this horse came into the barn at one of the driving barns, this was a 4th level riding pony. He was an advanced driving pony. But on the left-hand side, his conditioning and his training were not up to par. I knew he would make a great program. You can see the profound difference by improving that horse's posture. I didn't change his conformation. He was a mature horse, so his skeletal framework was the same in both photos, yet his outlook, his appearance is so much better on the right-hand side. That's pretty profound, isn't it? I can jump up and down. I think it's pretty fun. So that's what I'm hoping to have you get pretty enthusiastic about seeing the difference that you can make when you understand that that ewe-necked horse or pony, that's just poor posture and not poor conformation. So I say posture's the language of the horse. Just as I was speaking about earlier, my body language is going to tell you how I might be feeling on the inside and on the outside. The same thing is with the horse. You can approach a horse in the cross ties or as the owner's bringing it up and stands it up for you, and you can tell actually whether that horse is in a good mood, it's in a bad mood, it might not be feeling well. So we want to observe the posture and utilize that to our advantage in handling horses. So another example, which mare is prettier, happier, or sounder? Both the same mare, different points in her time of her fitness. That is not a pretty mare on the left-hand side. She's not comfortable. She's not happy. She doesn't have optimum conformation. It's not horrible, but it's not optimum. But you see when we improve her posture on the right-hand side, she presents as a much nicer horse. She's a higher quality horse, we might say. That mare was down on South Padre Island taking people on beach rides. Good posture is the foundation for optimum biomechanics. Good posture supports proper joint alignment. Good posture supports proper joint range of motion. I don't know if you actually know, but our joints get their nutrition through movement. A lot of you are probably sitting out there not having worked for the week, feeling kind of stiff and uncomfortable because your joints aren't going through that full range of motion, so you're not getting that lubrication going. So when we have good posture, good alignment, the joint range of motion is there so that when we're feeding ourselves or our horses, we're going to get more bang for our buck with our nutritional supplementation. Good posture will reduce stress and strain to the soft tissues and wear and tear to the joints. It sounds pretty simple, but it's pretty profound. So I say, don't let a pretty top line fool you. I pulled this off of Facebook because it was pretty perfect. You can see where the handler's trying to get that horse to stand four square, stand up for being shown. Now when we look, she has a pretty top line and she looks like she's in good condition, but then when we look down below, she's fairly long in her pasterns. So conformationally, she's compromised. We need to optimize our posture. We need to optimize the posture of the horses to make up for any weakness in the conformation. So don't just look at that pretty top line and say that mare's going great. She looks great. We need to see how is she standing in her posture on a regular basis. So the foundation for good posture starts at the feet. I'm a chiropractor. I work on everybody's feet. I say, if you have your shoes on, I won't adjust your feet. If you want me to adjust your feet, take your shoes off. It's all about working efficiently in gravity, being grounded, and knowing where we are in space. My mentor and farrier, Dave Duckett, taught me before I was even adjusting horses that the optimum support for good posture is for the horse to be standing easily four square with all four cannon bones on the vertical. That's just good physics. That's how this building is built. That's how this podium is built. So the more efficient I am in gravity, with my ear over my shoulder, shoulders over my hips over my heels, I'm going to have less stress and strain and wear and tear on my body parts, as is the horse. So we want to have good, healthy, and balanced feet as the foundation, but that's not always how it starts. Now, if we look at this horse over to the right, before I started my lecturing, you might say that that horse was standing 4 square, but she's not. This is the same mare, 2 different points in time in the program, and with this vertical line, you can see she's standing with her shoulders over her front feet. Well, what is that going to do to the soft tissue? That's going to put stress and strain on the suspensory ligament, on the flexor tendons. It's going to put compression onto the sesamoid bones, the fetlock joint, the pastern, and the coffin. And it's going to go ahead and either create or perpetuate the long toe, low heel syndrome. And then we look at the horse even coming back through her top line. She's counterbalancing, trying to get her center of gravity normalized. And she's standing actually with her hocks and her stifle straighter than she should be. So we need to make sure, just like this building in the background, that those cannon bones are on the vertical to reduce the stress and strain to the lower limb and reduce the irregular weight bearing onto that joint capsule. So gravity is the has unyielding effects. You can't say, I'm going to improve my posture in 30 days and it's going to stay like that, because gravity never stops. You can see even closer, again, how significantly that mare is standing over her feet with her chest and compromising her posture, her soft tissue, and her joint capsule, hoof capsule. So we want to assess and address the horse's postural imbalances. I saw Gary Wells earlier yesterday, and he helped normalize my posture. He was evaluating my shoulder height, my ear height, my balance front to back. We need to be a little bit more patient with ourselves and have our clients be more patient and take the time to look at the horse from the right side, take some pictures, but then you have to walk around and you have to look at the left side. You have to take the time to do that because it is so profound in understanding how that horse's posture is. How is the alignment of the body parts? We want to look from the front and we want to look from the back as well. We're going to look for asymmetries from right to left. You have to literally do that on a regular basis. And once you do it, it doesn't take much time at all because we're going to focus on specific areas of the body. If you look at the throat latch of the horse and compare the right side to the left side, it's a very good point of showing how the symmetry is, the length and the contour of the crest, the height of the withers at the cap of the scapula, the angle of the shoulder gives you a nice little concept of how that is tying in, and the distance between the point of the hip and the rib cage. If one side is tighter than the other, that horse is already bent through his lumbar spine. He's already crooked. So you can look at the depth and the distance from the point of the hip to the last rib of the horse. So we'll look a little closer at this mare. Which side is prettier, right? So is the prettier side the easier side to shoe, or is the less pretty side easier to shoe? I don't know. It's going to change. But when you can see the difference, you can relate things more effectively to the owner or to the work that you're doing or trying to accomplish. We look more closely at this mare. Her throat latch on the left side is more open. The length and contour of her crest is pretty. Her top line's okay. She's not standing 4 square yet, but generally speaking, she looks like a fit, healthy horse on the left side of her. Run around to the right side, which is literally within the same minute because it's time stamped. I had tried to get her to stand 4 square, nice and square on the left side. And by the time I went to the right side, her body went to the path of least resistance, and she put her right foot forward, right hind foot forward. And then you can see she's not the same contours. Her throat latch is tighter, her crest is dipped, the angle of her shoulder is different. This underside of her neck is showing something funny. It's thicker, and she's a little bit, has a different angle to her croup, and you would see, if you were close up, she has a different distance from the last rib to the point of her hip. She's not very pretty on that right side compared to the left side. This mare came to me with the history, or I went to see her, with the history of chronic right fore suspensory problems. Why would that be? Because she's not working very well on that right side. That pretty side just not working so well. And why is that? When we look closer at the cap of the scapula on the pretty side, she has 3 fingers from the cap of the scapula to the top of that withers. Run back around, same day, within the same minute, take a picture, and the right side, the less pretty side, only has 2 fingers difference, right? Remember, the scapula is not attached by anything but soft tissue, ligaments, and muscles. So that mare is essentially like this. If you're like this, you don't have the same shock absorption ability in the sling apparatus as you do on this side. She has more tolerance and ability to shock absorb on her left side compared to the right side because her shoulder's jammed up into her ear. So that is going to affect the tissue that's most vulnerable. And in this horse, it's her suspensory ligament. If it was a thoroughbred, it might be the hoof capsule. But there are the things we want to look at and relate from the top up and the bottom down. This next set of photos is very, very profound. Say, which came first, the chicken or the egg? Was there a hoof imbalance? He had a very big discrepancy between his front feet. I was called in by the saddle fitter because they couldn't get the saddle to fit right, and the saddle fitter, as a massage therapist too, knew that there was a spinal misalignment. There was a problem with this horse's posture. If you look at the scapula on that right side, you can't even find a place to put your finger between the cap of the scapula and the top of the withers. Versus the left side, he's got like 4 fingers. That's huge. There are the things you want to look at. You look at the feet and they're not right and they're not coming around. Look at the structures above. Again, it is the soft tissue that's going to be affecting and supporting the alignment of our body and the symmetry. That is the posture. So this is poor posture, not necessarily poor conformation, because I'm not showing you a skeletal structure there at that point. So this is a beautiful picture, I think, taken again off of Facebook. And it shows the fascial outline of the heart. Many people will say that the fascia of the muscles in the soft tissue is considered the dynamic and stabilizing framework of the body and even the organs. So seeing this picture of the heart where you can see the capillaries and the arteries and the actual structure of the heart is outlined by the fascia in and of itself. The fascia is a very, very important tissue that I'm sure you've heard of and we will continue to hear more about, because it's just not a tissue. Every bit of fascia is connected to the nervous system. So that fascia is going to give us an awareness in space. And that's going to help us function better in gravity. So the skin, if you didn't know, the horse's skin and your skin is the largest organ. And I say it's a crystal ball to view the function and efficiency of the myofascial and nervous system. The skin is not a hide. It protects sensitive structures beneath. It regulates temperature by dilation and constriction of blood vessels, and the hairs coming up and down. Those hairs have an important function in insulating the horse. It aids in elimination. It's an elimination organ like our liver and our kidneys. And it provides sensory input from the outside environment to the nervous system. So whether there's a fly landing on that horse or a spur touching that horse, or you're bent over shoeing that horse and your coat touches that horse, if that horse isn't comfortable in his own skin, that's going to affect that horse. So we really, really, really need to appreciate the horse's skin. This was from a whole horse dissection I was at, and I just thought it was a pretty picture. The skin was dissected apart. I'm sure there's a lot of hunters there. When you're hunting and you're taking care of your game, appreciate what you're actually doing, because it's going to relate with what you're doing with your horse's understanding the connection and the intimate relationship between the skin and the sensitive structures underneath, being the lymphatic system, the circulatory system, the fascia, and the muscles, which are going to help our posture. So the horse's skin is their clothes. If I was up here in a fitted suit, old-fashioned fitted suit that didn't have Lycra, I would be kind of standing a little stiff. If you remember when you were wearing pants and they didn't have the elasticity to them, by the time you were bending down there for 2 or 3 minutes, the compression of those clothes are going to inhibit the joint. So we want the horse's skin to be like their Under Armour. So it's moving and gliding all over the place. And we can look at the skin and start to understand how that is affecting the structure underneath. Is he standing 4 square comfortably? Is that fluid dynamics under that skin looking like he can stand 4 square comfortably? Is he comfortable in his own skin? If you've ever had the flu, you're not comfortable in your own skin. You don't even want your clothes to touch you. And you'll see horses. You have seen the redhead thoroughbred mare that is standing in the cross ties, does not want to be approached, does not want to be touched. If you think about it, she doesn't look comfortable in her skin. She's actually tense and tight in her skin, which is going to compress the circulation, compress the joints and the muscles themselves. So they are not comfortable. And it's looking at the skin, using that as a crystal ball to understand the posture and how that horse is actually feeling and how they're going to potentially respond to the work that you need to do. And how can you address that so that you don't have so many difficulties with a horse. You see, this horse, he is not comfortable in his own skin. He's stressed on the outside, he's stressed on the inside. This will not be a comfortable horse to shoe. And we see these little red flags that start to pop up here. And I've got an assistant in the audience because this is my shtick. I have my shtick. I have a red flag on the end of the stick. So I mentioned before, I want you to go home and own red flags. So I'm going to be walking around at times and wagging my red flag because that horse's skin is a big red flag. If you approach that redhead mare that looks tense and tight in her skin, you need to approach her with a different frame of thought and how you can actually have that outcome of that shoeing turn out to be positive and safe. So we're going to assess the horse's skin and the body contours for myofascial imbalances. What are those myofascial imbalances? They're red flags. They're dents, they're dings, they're white hairs, they're loss of hairs, they're irregular contours. A red flag is when you approach a horse that has a big crease in his back and he's head high. His posture is telling you he's in fight or flight. We need to look at these things and take them seriously. Because unfortunately, this is my pretty car. We're usually more concerned with a scratch or a dent on our car than we are actually acknowledging these sort of defects in a horse. Isn't it true? That car has a scratch on the side of a superficial scratch from a dog. Every time I walk up to that, I'm like, darn, I remember exactly when and where that happened. I had paint chipped on the hood of my car, 2016, driving home from Rolex. That annoys the crap out of me. But it's not going to affect my car's performance. But why haven't we been taught as horse professionals and owners and trainers and horse care providers that these dents and dings actually have a history? We need to see them, and we need to acknowledge them, and we need to address them. And it's a lot of fun, and I'll have more pictures coming up to show you how much fun that is, but that's why I want to be adamant about the red flags, and I put a bigger red flag on for this audience because it's a bigger venue. But we can see with the little red flags on the picture here, there's a dent, and there's a dent. I can't tell you how many times I see a horse and I ask the owner, how long have they had that dent? They usually say one of two things. What dent? They never even notice the dent. Or they'll go, I always wondered what that was. That's usually what I get. They either don't even say it, or they have wondered what it was, but they never asked anybody because they might have been told it was cosmetic, right? It's just there. It's not pretty, but it's no big deal. So a little segue relative to cars and horses. So I've come up with, over the years of looking at horses' gaits and biomechanics and anatomy, to go ahead and describe the point, cap of the scapula and the point of the hip as functional axes of rotation. These areas have a lot of muscles that are stemming off that are kind of like the spokes of a wheel. So I say the horse is an all-wheel, or it's all-wheel drive horsepower. I just came up with some of these phrases, so sorry if I'm not so fluent with them. But I think it works very nicely. And as I think Dr. Van Epps, he might have mentioned the Mayu Bridge racehorse. If I had time, I would put that video up here because it beautifully shows where the cap of the scapula and the point of that hip and the extension of the legs can actually be viewed kind of like the spokes of the wheel. So that's a really cool video. You can pull it up on Wikipedia, video of the still frames of it. So the functional axes of rotation, and this is important because when you're shoeing a horse, he's like this. If those spokes on that wheel aren't well balanced, or the spokes on the front end, guess what? That horse is not going to be able to stand comfortably. So we need to look for the red flags along those spokes that might be causing discourse in that horse's posture and overall function. Back to the dents and dings, white hairs are flat tires on the road to peak performance, longevity, overall well-being for the horse and the human. Why do I say for the horse and the human? For the human as well, because if that horse isn't safe, you're not safe. And for you, guess what? You have dents, dings, scars, right? That are affecting your posture and your mechanics. They indicate a site of previous trauma. What does? The red flags. That dent in the horse is a site of previous trauma. It may be healed on the outside, but it's not healed on the inside. What is that dent? That dent was where that horse got kicked and there was a hematoma and there were compensations from it. That's a history. You look at the dent and you go, how did that happen? I don't know. It's shaped like a hoof print. So it tells you a history of what's happened to that horse's body. They hold deeper scarring. Just because you look at it, it might look like it's a 1/4 inch deep. You want to get in there and you want to palpate it because it can feel nodular, it can feel like baling twine, it can feel like a little pea, and that's the scar tissue because there was so much trauma to the muscles that it was reabsorbed and there's a defect and it's now second-class tissue, right? So we need to see how that's going to affect and cause compensations in the posture, the symmetry, the gait, and the soundness of the horse and the hoof balance itself. These restrictions of scar tissue can be just that, a mechanical restriction. Or they can be a restriction because it's painful. It just really depends. Some people, you can pull their hair and no problem. Other people, you pull their hair and they get tears in their eyes. It just depends on how their nervous system is wired. And then sometimes it's a mechanical restriction and pain restriction like trigger points, which can have referred pain. So going back to this horse with the dents in his shoulders, the red flags, crooked shoulders is a crooked horse. I first looked at this horse and the owner had told me that the horse was having problems jumping and galloping. Well, if we look at the photograph on the left-hand side, the horse's feet are turned to the right. Both front feet are turned to the right. Guess what? It's not both front feet. It's the front feet and the shoulders have turned. Is that poor posture, that poor conformation? It's poor posture. We already know, right, because we learned about the red flags, that there's a dent across the horse's shoulder and into the chest. The chest muscles do this. Well, if you have a hematoma here, which lots of times we don't actually see the big bruise of the horse because they have a coat. We don't see bruising, we don't always see the swelling, and they're not always that reactive to it because there's so much trauma to the tissue, it's not always that painful. So as that hematoma, that swelling goes down, if you do see it, you're like, oh, the swelling's gone, everything's good. But over the next 2 or 3 months, that tissue starts to compensate and that horse's foot starts to rotate in. This one rotates out because we have to work and function in gravity. And then you have a horse that's like this. That's the compensations. It's pretty profound. And then we can look at this horse too. He's not quite as symmetrical on his feet. I can help above, and then you can help from below. And it's good to know that we're working on the same issue at the same time, because I know a lot of farriers would want to make some changes, but they're afraid to make changes too quick. But if you're working with the owner, who's working with a chiropractor, or they're doing their own soft tissue work, you can go ahead and advance some of those changes much quicker without as many panic periods, as Dave Duckett would say. So the red flags, again. Red flag. A big red flag. Does everybody have a red flag? Look, Dr. Riley, he was happy enough to carry a red flag for me. So we have the dents and the dings. We have bubbles. We have the creased back. You have scars. The scar can be from a rope burn. The scar can be from barbed wire. The scar can be from an incision and the sutures. White hairs shows trauma, and trauma that they're still perpetuated because the inflammation is creating the white hair still. Hair disruptions and irregular body contours. Very common, right? Dents and dings in the point of the buttocks and the point of the shoulders. Why? Because horses run into other horses' feet. They run into fences, they run into doors, they run into jumps. Horses have dents in their butts because they're backing up and kicking into each other. They run backwards into things. It's such a big contusion that it causes the hematoma, and then we get the scarring. Well, when we have the dent in the buttock on that left side, if you're looking at the horse from behind, that hamstring muscle, right? There's an attachment up in the sacrum, the point of the buttocks, all the way down, affecting down into the stifle and the hock. When you have that restriction there, you'll get a pelvis that's posterior. You get that pelvis that's posterior, you're going to change the angle of that hind leg. In the shoulder, when the horses have a dent in the shoulder, that is typically affecting the brachiocephalicus muscle, which actually goes all the way up across the cervical vertebra and has fascial integration up into the back of the jaw. So when there's a dent in the shoulder, you're going to potentially have tightening of the throat latch. You'll have a compression onto the cervical spine. It'll affect the shoulder, the elbow, and often reflect right back up into the withers and cause a flat spot in the withers. So the dent in the shoulder or the dent in any area up on the neck will have the same effect, because that fascial tissue and that muscle mass of the brachiocephalicus and the sternocephalicus is intimately connected and influenced. We look at this horse. This horse was having problems cantering to the left. It's sad, but it's really fun to say that this horse was owned by a large animal veterinarian. Owned and competed by a large animal veterinarian. Thank you, Dr. Riley, for laughing. But that's because they weren't taught to understand and appreciate that that dent is more than just cosmetic. You can see, just with the horse standing there, he's not looking very comfortable through the base of his neck. And then when I actually pull the front leg forward, as if it was going onto a hoof stand, you can see how uncomfortable that horse is, how that dent changes because it's fascial tissue in the supraspinatus, and how it's affecting that horse's whole neck. He may not be very easy to stand comfortably to shoe. His quarter might run out sooner than later, pulling that foot forward, or maybe the right hind foot. But these are the kind of things that are going to affect the process and the outcome of your work. This is another nice dissection photo, and this is the brachiocephalicus peeled back, and it's profound. If you can go see a live horse dissection, is what they call it, because this horse was alive like 4 hours before they did it, and he wasn't embalmed or anything. So that tissue of that muscle, the brachiocephalicus, was like this thick. So when you see a dent that's, a half an inch deep and you palpate and you almost feel the bone, that's how deep and traumatic that injury is. That's huge. Coming in, if you have a hematoma here and you have a big dent in your shoulder, that's not going to function well unless you get that rehabilitated. Multiple red flags. This horse is just not pretty in his chest. This horse he's an Arab Cleveland Bay cross. The first 3 years lived his life out on the pasture with the other herd, which is a wonderful thing. And you maintain their feet, you maintain their hooves. But if you don't realize they're getting the snot kicked out of them, and they're having all of these hematomas and fascial restrictions when you bring them in at 4 years old or 3 years old to go ahead and break them and you have problems, this is what it's from. So it's nice to monitor those young horses. If you're a farrier and you're taking care of a bunch of thoroughbreds or a breeding farm and you see these things on the young horses, you want to bring it to the attention of your owners, because that's going to affect the growth and the posture of that horse. That's going to affect those feet. I do a lot of young horses for hunter breeding. And right away, they look at those feet and they know they need to talk to me about it so that I can actually help normalize that horse's alignment and posture and comfort in their tissue so they're weight bearing evenly on there. So it's really, really huge if you go ahead and relate this to the owners.
Yes, it's very interesting. I have a horse in my practice that, now you're saying that, something that relates perfectly to the feet, but he has an injury on his right side.
I'm sorry, I have a yellow light here. And when did you turn that on? 4 minutes. Oh, we got to go fast. So this horse, we talked the other day about oxygen. This horse has profound, he got gored. This horse was off the racetrack. He actually had a drain in him. You see these horses, they don't want to be touched. 5 feet away, they're not happy. They can't breathe, they can't stand, they're not comfortable. They're big red flags for you to work with. The white hairs, again, bubbles, that's a dent in the tissue that's causing that the skin's popped off. You take care of that. That bubble, it's just like the hamstring. That pelvis is uneven. You take care of that myofascial restriction and you change it immediately, which is what I'm going to get to. So this is about the type, the crease back is not a fat back. That fat jiggles, that's not jiggling. That's a horse that's standing tense like this. You need to understand that and recognize that that may be a problem with your outcome and your shoeing. So I'm going to fast forward to our before and afters. So what I say, you're going to find it, look with your eyes. You want to look with soft eyes. Don't just focus on the feet. Don't just focus on the leg. Don't just focus on the head. Look with soft eyes of that horse. What is the fluid dynamics of that horse's skin telling you as they're standing there and as they're moving? Fluid dynamics, that skin is moving freely over every body part and bony protuberance of that horse. The mare we saw earlier, she had a bubble. Took care of that bubble. Her pelvis leveled out. The roach back cleared up some. Her withers came up some. And then she's standing truly four square on all 4 feet. This horse, this is really fun. This is profound. This was the horse with the gored side. He did not want to be touched. Look at his posture where his neck and crest is hollow and tight, and he's got this little dent there, right? So this is within 1 minute. I took a picture, and I went and I took my thumb. I'm not joking you. I took my thumb, and I just mushed and pushed. I did cross fiber on it. I went back. The other picture looks different because I turned the flash on, and that's in a minute. But look at the difference in the posture from the left side to the right side. It seems impossible, but when you normalize that myofascial system and take those compensations away, it's profound in how you can change the horse's posture and demeanor. This horse, if he wasn't in a winter coat, you can only imagine what those dents would be like. 16 months apart. You can see from here, these dents are lining up. Here, they're totally different because in the first part, the first picture, his shoulders were up here. We released those. His shoulders came back and opened up. So the soft tissue changed relative to the structure of the skeleton, the actual conformation. Again, this is really profound, guys. Tell me, isn't this cool? This is the same horse. This is before, this is after. And this horse was like 16 years old to start with. To know that you can make those changes and help that horse, it's a lesson horse. Barefoot, bitless, lesson horse. Did not have the opportunity of somebody training him, schooling him so that he was getting the benefit of good rehabilitative care. So before and after, this is just a little review. Don't be settled for disease. Ticklish, girthy, whether it's your own horse, they're cranky, they don't like to be groomed. They are telling us with their body language, with their posture, with their posturing, because they're prey animals, how they feel. Take that into great consideration. This just goes back to talking about from the bottom up and the top down. Teamwork works, and it makes work more fun. It makes work not just work. It's a profession, and it's a passion that you have. So, reviewing, we'll bypass the review. The big thing is, did you get the red flags? Yes? Hello out there, yes. Did you get the difference in conformation being the skeleton and posture being the alignment, right? That you can change relative to the myofascial system. And that the horse needs to stand 4 square with all 4 cannon bones on the vertical. So I appreciate your time and attention, and I'm happy to hear from you later today or whatever. I don't think we have time for questions, but I'll be around. I'll be lecturing tomorrow, doing a workshop tomorrow as well. So thank you very much.